We just had it, but how about Brittany Rich? When's a typical age of onset for schizophrenia?
For men or women?
You can make it universal.
Oh, well,
One hit both of them.
20s and for women, 20s to early 30s.
Yeah, so, late adolescence, 20s. Women can go up to 30, but like that kind of thing. Early adulthood period. Disease of that population. And go ahead.
Does the chances go down the older the person gets, like as far as say 27, 28, 29, 30, does it decrease or it just stays within?
I do not, that's a good question. I'll investigate that. I know that, many times with older people, it's due to another cause, like it's like due to either, like it can be a drug interaction, it can be an organic problem if you get it older, like it's not pure schizophrenia, it's often older people and some other organic disorder.
Oh, okay.
How about easy enough. Marissa, I'm gonna ask Marissa a question. What's the difference between a hallucination and an illusion?
So an illusion, something's there, but they perceive it differently.
Yes, an hallucination.
Hallucination, it's not there at all.
It's not there, and
They
it's
made
just.
That's sunk in. Something
But
to do with that.
of course, it's very real to them, which is, this is a stock line, triple star question your future somehow. Whatever they see, I believe it's true for you, but I don't see it. Like, again, it's just like somebody with Alzheimer's, dementia. You're not, or a little kid for that matter, you're not getting to a fight with them, like, no, it's not there. Like, there's no bugs that are crawling on the wall. Like, stop acting crazy. Like, obviously, if I could stop acting crazy, I would. I can. But, I know you see that, but it is not there. I know this is really frightening for you, but it is, I don't see it. So there's specifiers to schizophrenia. That's a specific symptom that predominates the person's presentation. So catatonia, seen a lot. The person, so if somebody's like, even though catatonia, the catatonic symptoms are a whole spectrum, a variety of disorders. Catatonia is just, it's just a picture, no picture. So, but this is what catatonia looks like. They sit there, kind of in a trance-like state. Looks like they're in a coma, but they're not in a coma. Like they don't have a neurologic deficit. So there's no neurologic deficit, or they're just sitting there, not moving, no speech. And here's, funny one about paranoia. Seeing a 10th doctor about paranoia, and then somebody looking paranoid. So delusional disorder. So even though this says non-bizarre, I have, just again in my limited practice, they can be pretty out there. So, at least a month in duration for these delusional disorders. So their functional ability is not impaired, but they're just thinking odd things. So this is on page 347, all the types. Again, these, hate to say, but we're awfully ignorant in the ER. So
We definitely should know all the types.
yes, yeah, because these are common questions. So erotomanic is one type. So page 347. And your text. And this is just where it says various subtypes starred. We love our stars, so know the stars. So erotomanic is one, and I'm getting it right down for a reason. Okay, let's back up. It's page 347 in the textbook. But now I'm just saying exactly what's on the page. And injecting weird stuff. So 347, erotomanic is one type, and this is common. You know, someone's in love with you, a famous person's in love with you. You're dating a famous person. You see a lady who came into Lankenau frequently, thinking that she was having an affair with Michael Jackson, who had long since been dead. And in one time but it was bad. One time she came with a bag and tried to, abduct a baby. Yeah. So, but the functionals, like, she could drive a car, she was gonna, to get there, like, she wasn't that, she organized herself that well. So grandiose type, is again, that you have a special relationship with people, like, I'm friends with the Queen of England. So grandiose delusions. Or I am the Queen of England and she's actually the imposter, like, I'm the gender article right here in front of you. So that's grandiose. Jealous type. So this is that, their significant other or spouse is cheating on them all the time.
Say jealous.
Jealous, yep. So somebody's, being unfaithful, like, but to, an irrational extent. And then persecutory type. Persecutory, thank you, I missed the syllable. So people are trying to kill you, after you, chasing you, and they're not. I'm not being funny, unless they are, like, people could be. Do you want to investigate that? And then there's somatic type, so that you're, you believe you have some type of medical illness, been worked up for it, but you have this persistent belief that you have it. So that one's an easy one, That's what we have, somatic presentations of things. Somatic just means of your body. And then they could be a mixed type, so that's, more than one thing. So I'll say it again. Erotomanic is, think somebody's in love with you or you're in love with somebody famous. Grandiose type, I'm the vice president, I wish I was. Jealous type, you think people, your significant other's cheating on you or you're getting cheated on. Persecutory, people are persecuting you. Then somatic and mixed. So then we talked about, substance abuse or medication abuse, psychotic disorder. So it can be induced by medications. So we said, kind of the illicit drugs, PCP, special, mushrooms, peyote, and we can go on and on. But what kind of prescription drugs make people have psychotic problems? Sarah, I'm not Sarah. Well, I heard it's just the anesthesia. Anesthesia could. And actually, special K, but ketamine is an anesthetic agent.
So the medications you're talking about?
Yeah, but just prescription medications. Their intent isn't to make you psychotic, but after. They don't make it so much psychotic. I mean, they can cause central nervous system depression. I don't know, like in the gym.
Oh,
Yeah, Roy rage. Like, that's a real thing. I'm probably stopping them, but even just being on them for therapeutic levels make people a little alter sensorium.
Yeah, I didn't realize that I had a picture today that was on steroids and she was like really giddy and like happy. I didn't realize they made you like that.
Yes.
And she couldn't stop talking.
Yep. Real talk. Make you not up a bit. And another, even some antibiotic, it really could be antibiotics, anti-cancer agents. This is right on page 349. We will hit them again when we get to the medications. But again, it's just to really heighten your awareness that I'm, checking a urine tox screen really in everybody to make sure one, getting good history, which we'll get to, good history of medications that they're taking, things that might interact together. But highlight of the medications is right on that page 349. And also, general medical conditions. Does anybody know of a medical condition besides, we said brain tumor, we said, what else?
Trauma.
Trauma.
That what caused the movement?
What'd you say, Keisha?
You said a condition that causes what?
That will cause psychotic symptoms, a medical issue.
Like UTI in geriatrics?
Say it again?
A urinary tract infection in geriatrics?
They could get psychotic, that acute delirium.
That eye surgery,
What kind of eye surgery?
I don't know, but it was making people crazy.
Real, I
They
never
were
heard.
doing like some type of surgery that was making them, and they were like, they were winding up suicidal and stuff.
Get out!
Medication from them.
I never heard about that one. I love stuff like that.
Not famous, but one of the newscasters actually wind up committing suicide because of it.
Was it LASIK surgery?
Maybe. She never.
Now that you said that, I do remember that now. Okay. Well, hepatic encephalopathy, that's a big one. Somebody has liver disease, they really get, start seeing things, hearing things. Another hot one is porphyria. So I'm only saying porphyria because way back in the day, because I'm a weirdo, I love like medical history. People had porphyria, which is a blood dyscrasia, but that's how kind of the legend of vampires started. If people were really pale, they would sleep all day, they would have hallucinations. So it's probably that they had porphyria. They really were vampires. It's always an unromantic thing to a lot of folklore. But all those medical problems on page 349, and that's table 15-2. And it's not to memorize it, it's just to, again, think that we want to investigate medical causes. It could be something medically, either making you have the symptoms or exacerbating the symptoms. So this term schizophreniform, I've never heard of this one. I guess if I was more involved in mental health care, I would. But this means it's a shorter duration. So it's longer than a brief psychotic episode, but less than 6 months. And schizoaffective, so that's schizophrenia with mood disorder symptoms. And mood disorders are, prominent ones are depression and bipolar disorder. So, schizophrenia is your main thing, but then you have these mood disorder symptoms. So, again, examples of positive symptoms. Mr. T-Bone, T-Name Wilson is gonna be, what's a positive symptom in schizophrenia? We're all thinking, all of you. Repeating
Things you hear.
Yeah, known as. You got it, mister. I'm repeating what you just said. Begin with the E.
See, you just can't pronounce it.
Doesn't get echolalia. So you're repeating. Did you see? What's another positive symptom? Yeah. So and what? Yeah. I was gonna say give me a type of hallucination. Of all those senses, in your senses. The most common type of hallucination. Yeah, tactile or the auditory hallucination. And how about an example of a negative symptom, Scott Park, would be
Depressed mood.
depressed mood.
Yeah, anything else that related to depression, suicidal ideations.
Yeah, it could be suicidal ideation, right? Yeah. Muted, poverty of speech, that's always a big negative one. And then, so mood disorder symptoms, I'll tell you these, even though you probably know already, but depression, obviously, you have sad mood, tearful, apathy, and anhedonia is big with depression, so that no joy, anhedonia. And then set examples of mania. So again, I just revisiting Mrs. Austin's lecture. Mania is gonna be what? Yeah, so lack of sleep, lot of energy, rapid pressured speech, odd dress. Then brief psychotic disorders. So again, at least one day, but less than 1 month. Again, and that could be, again, in that mood disorder spectrum too. And then shared psychotic disorder. So this is a very unusual one, so that shared psychotic disorder, that's in the spectrum, just like where the new term for multiple personality disorder, what was that new term? Yeah, dissociative identity. So this one's as rare as that. This is when 2 or more people share the same delusion. So the French term folie à deux. So there's 2 famous cases, Leopold and Loeb. I don't know if you heard about that one. There was a pretty good movie about that, where these 2 rich guys, it was like in Chicago, they just plotted to kill this little kid, and they killed this child just because they did. But it's always the same kind of dynamic. One personality is more dominant, and the other person just kind of does it with them, but they, have this psychosis together. And there's another famous French example where these 2 sisters ended up killing the woman they worked for, but they ripped out her eyes and everything. It was just, they just went insane. So trust the process. Here comes the nursing. So that's all about the disorder. So first thing's always gonna be what? Assessment, and now we want safety. So, not that we don't feeding into the hallucination or delusion, representing reality. We want to know if the person's if they're having command hallucinations to hurt themselves or others, then we need to know and intervene to keep them safe and us safe. And SI is just that suicidal ideation. Again, we want to know whether they're passive or active. Homicidal too, is it, I could just kill that guy, or I'm going to kill that guy. We know that, the difference of, I'm planning to kill my neighbors. So I say that all the time, and I'm only 25% kidding sometimes. So patient interview, past medical history, because we want to know things that could be causing organic problems. So we said, do you have, have you had a head injury? Have you had some, family history of brain tumors? Do you have bad asthma? Now you're on corticosteroids. And past surgical history, you wouldn't think would go into it, but perhaps maybe if they, had a bowel resection, now they're in chemotherapy, maybe that's altering their sensorium. So medications that they're using, and what else with the medications? Remember, you learned on Saturday.
Interactions,
and herbal supplements. They're on herbal supplements. A lot of herbal supplements can alter one's sensorium, especially if it's a drug-herb interaction. Then, of course, what their alcohol and or drug use, if present, what it's like. So vital signs, and what do you think is really going to be a worrisome, could have a vital sign that would change our mental status?
Hypo.
Oxygen saturation.
Well, yeah, the respirations, but
Saturation.
yeah, could have a low O2 set. Hypoxia definitely can cause a change in mental status. And another one would be
hypotensive,
blood pressure could, even simpler. Yeah, if you have a fever. You have a fever and some bad infection. So of course we're checking everything, but fever, pulse ox, your easy ones, and they're kind of easy fixes, If it's not a contraindication, I'm going to give them some oxygen. If it's not a contraindication, I'm going to give them ibuprofen or acetaminophen. And of course, my holy grail is somebody's blood sugar. So, really could be acting erratically, and then this could be really hypoglycemic. Could be hypervis, typically hypo before they totally go out. So then, and hopefully this person does have a support system. So when it's, hopefully they're in a stable living situation and not, in an abusive situation. Because here's another issue, because I'm doing the violence lecture too for this class. This is a very vulnerable population, just because people don't believe them. They can be getting abused, sexually assaulted, and nobody's gonna believe you. Like, and it, maybe it happened, and then they have post-traumatic stress disorder from it happening, and they keep thinking it's still happening. But very vulnerable population that's not believed, sadly. So what is the relationship with their family members, and what's the family think about just mental health in general? And remember, it doesn't have to be genetically your family. This somebody's healthier that cares about you. So important tests. We said you're in drug screen, but just like Kathy said, and we're all thinking, what else do we want to check? Besides your urine for illicit drugs, you want to just check in general
UTI.
your other electrolytes. So they're, sodium, potassium. Remember, sodium's going to alter if we're hypo or hyponatremic especially. So electrolytes in general, and gleaning from the history that we took and looking at them physically, that's going to lead us to other labs we can check. They take off their clothes and they have a yellow cast to their skin. Well, maybe you're jaundiced. Like maybe you've got some liver involvement.